Next, Tammi Kapitanski will demonstrate raindrop therapy.
Hi, I'm the owner of Remedy Within. My name is Tammi Kapitanski, and I own a massage therapy practice along with energy therapy. Now I'm going to be showing you the raindrop technique on a client. What I start out with is an energetic oil using Valor as raising the vibration. And what I do is I place the Valor on her shoulders to start to heighten the vibration of the massage and get her body used to the essential oils. When I practice the raindrop technique, depending on the client, what I'll do is place different amounts of oil along the spine. The first oil that I use about 5 drops on each scapula area, and I rub that in to, again, stimulate the body and start to move the energetics through the body. I'm going to start out with our next 2 oils. These are the hot oils of the body, placing them starting at the base of the spine, about 6 inches away from the spine, stimulating the raindrop technique as rain would drop along your spine. Depending on the height of the client, you use anywhere from 5 to 7 drops of oil along the spine, and also depending on which oils you use. The first 2 oils that I use are oregano and thyme, and again, these are hot oils. They're spicy. What they do is they simulate or start to stimulate the blood flow, get the circulatory system moving. Rubbing it along the base of the chakras, the base of the sacral area, getting the low back area, and feathering lightly along the spinal cord. And you do this technique 3 times along the spine, raising the chi, or the energy vibration, getting that energy moving along the spine to release any ailments, to release any energetic blockages along the body that she may be holding from childhood or adulthood, depending on her experiences through life. The next oil starting at the base of her spine is basil. This is a muscle relaxer to help release the tension and tightness in her muscles. The next oil I'll be using is marjoram, always starting at the base of the spine. The next oil I'll be using is wintergreen, which is a huge anti-inflammatory. The next oil is called cypress. The next oil I'll be using is peppermint. And again, peppermint is a large anti-inflammatory, cools down the muscles, takes tension away, and helps alleviate pain in the muscles. The last oil that I'll be using is a blend, and it's called Aroma Seas. It has a blend of lavender, basil, marjoram. I actually add extra of this oil along the shoulders and along the base of the sacrum. The next process is using an oil called Ortho Ease. What this does is it's a carrier oil, and this is going to help slow down the absorption of the 9 oils that I began with. This is going to also cool her down when the hot towels are placed on her back. It also has essential oils in the blend itself that help relax and release the tension in the body. The next step, I'm going to be placing a dry towel down along my client's body to protect her skin from the hot towels. And what we're going to do is kind of tuck her in, just to make sure that the hot towels don't touch the rest of her body. I'd like to get the towels as warm as possible, but I always shake them out just a little bit to get some of the initial heat out of the towel. You also don't want to burn your client. And I'll be folding the towel in half, one starting at the base of her sacrum, going to the mid-back. The next one I'll be folding and going across the back of her neck and shoulders down to the mid-back area. The oil and water actually fight each other, so this is going to further infuse the oils in the body, going down into the cellular level to help release the toxins and help release the muscles. The next step is to take a large plastic bag, place it along your client's back, again tucking it into her neck, and what I do is I fold the dry towel over my client and seal her in, kind of tuck her in. The object is to get the client to withstand as much heat as possible, warming the body, but you definitely don't want the client having a burning sensation. What the client will experience now is normally they'll feel warmth in specific areas that are tense or tight in the body, so they may have a reaction of the shoulder may heat up more than the lower back, or the lower back on the left side may heat up in the glute area, because what the oils are doing is they're again further infusing into the cellular level, so they're going down layers upon layers to start that release process emotionally and physically. So the client may experience tingling, warming of a specific area of the body. I encourage them now to start taking a lot of deep breaths, slow deep breaths, to relax into the massage. I also cover my client to infuse a little bit more warmth. And what I'll do is let her sit for about 5 or 10 minutes and allow her body to just relax into the massage. And next what I'll do is I'll go ahead and massage her legs and her feet, and that usually is about 5 or 10 minutes. in between so you can let the towels infuse on the body. What I'll do next is I'll remove the towels, I'll wipe her down with a dry towel, and then I'll follow up with a deep tissue back massage or a massage. As long as your client can handle the pressure, a therapeutic massage would be best to infuse the oils in deeper to the muscles, but if the client prefers a nice relaxing massage, that will also help move the energy up the spine, along the body, and throughout the whole body. So you're actually treating the full body just by treating the spine.